Most people need services to support themselves or a relative at some stage of their lives. Since April 1993, the Social Work Department has been responsible for assessing people's needs for care and support and for coordinating services for them from different agencies. This is called community care. The Social Work Department here in Greater Easterhouse are committed to making local people aware that these services and resources exist. Community care is for people of all ages, from babies born with special needs to grandparents who may be doing well in their 90s but need some support.
Mary, can you try and get hold of
For people living in the Greater Easterhouse area, the Social Work Department is the key to getting community care services.
People can get access to community care services through any of the social work offices in Greater Easterhouse. They can either call in personally or telephone, and they also may write in, and letters will be acknowledged within 5 days. Where people are attending hospitals and clinics, they can approach the social work units in the hospitals or clinic, and they will route people towards the services they require. Any of the social work offices will take referrals. In addition, there is a social work unit in Easterhouse Health Centre which contains an office space for all of the GPs locally, and that's seen as a very convenient location to get access to services. Your request for community care service would go to the newly set up community care team, and they, in discussion with yourself and your carer and perhaps your doctor, will decide what priority you have to get and what services you require. There are a number of categories of care that are covered under the community care legislation, including vulnerable elderly people, people with learning difficulties, people with addiction problems, including HIV and AIDS, and any other progressive illness. Requests for help will be treated in the strictest confidence. Where people aren't sure about their eligibility for services, they should make a point of applying, because the Social Work Department is very keen to make sure that the maximum number of people possible can get access to services.
People need community care in all kinds of situations, arising from such things as physical disability, dementia, drug problems, alcohol problems, mental illness, being a carer, learning disabilities, blindness or loss of sight, deafness and hearing loss, children with special needs, head injury, HIV/AIDS, age and frailty. The Social Work Department is responsible for meeting with people, discussing their needs and arranging community care services for them whenever possible.
I'm the home care organiser for the Easterhouse area. That involves me as being the senior for the home care team, and I'm responsible for a wide range of staff, which includes home help organisers, home sport and daycare organisers, and a special urban aid project that's providing services to vulnerable elderly in the Greater Easterhouse area. I'm based in the Easterhouse Road office, and the aims and objectives of the home care team are to provide a very wide range of very flexible services to meet the wide range of community care clients. That can involve anything from children with special needs and the parents of children with special needs through to vulnerable elderly, perhaps very elderly people who are disabled. It might involve even somebody who's bedridden or terminally ill.
Well, my husband was paralysed for 9 months. And he had 2 operations during that time, and after the operations he couldn't even stand, so I had to lift him and lay him. And only for the elderly care, I don't know what I'd have done.
The domestic care is the traditional services often carried out by home helps, who will be providing cleaning or pension services for perhaps older people. But increasingly more so, we're providing a wide range of personal care services, which I would describe as hands-on services, where we're assisting someone in the home, perhaps getting up out of bed, getting them dressed, perhaps taking someone to the toilet, maybe tucking them down later on at night in the evening, perhaps bathing them. And that service can be provided out by a very wide range of home care staff.
They're coming in, helping, they're doing things for you, right? And if we didn't have them, I don't know what we would do. She comes in, she makes my breakfast, she makes my bed, she comes in, does all the work, she's good.
The clients we're catering for are obviously those in greatest need. We can't provide a service to everyone who necessarily requests that.
I came here about 3 times a week at the beginning, and then I had an accident with this arm. I fell in the house, and that was a soup plate all burnt. The soup plate, my weight was where I fell. So they supplied the car or the van to take me back and forward to the Royal. And that was no sooner better till I landed up here with a broken arm. So, I mean, I couldn't have done without them.
This service is a marvellous service. And how it helped me was I was housebound along with my husband. So in order for me to go messages or to get out for a couple of hours, the elderly care would send one of their carers to my house on a Saturday, say from 12 to 4:30, and I would get out in the town or whatever I wanted to do. And when I come back, my husband would be bathed, the kitchenette tidied, the bathroom as if nobody had been in it, tidied up, left perfect. If I couldn't sleep at night, the help was, I didn't use it, but I could have. The help was available here for me to go to bed and have a night's sleep, and they would sit with my husband all night if necessary. There's nothing that they wouldn't do for you. Nothing at all that they wouldn't do for you.
The home care team are very keen to promote independence of clients, of all clients. Promoting independence means working alongside a client, enabling a client and encouraging a client to reach their maximum independence. To give you an example of this type of task, our home support and daycare project in particular is involved with promoting independence for people with learning difficulties as well as people with physical disabilities. An example of that might be someone with learning difficulties who's perhaps attending the local further education college. A sessional worker will go along with them over a period of time and introduce them to the route that they're going to travel on their way to the college, perhaps returning again from the college over a period of weeks until the person's able to do that on their own, and then will gradually stop doing that for them.
My job is basically as a community development worker, and I work with people with learning disabilities who live in the Greater Easterhouse area in an attempt to assist them and become involved in the planning of services. It's very much a community care type project, or a care in the community project. It's about getting people involved. It's about providing people with information so that they can make appropriate choices about the kind of services that they need. And it's also about training. The project is mostly about the notion of advocacy, which is enabling people to ask for help themselves. The majority of requests for help that we receive are concerning information about where people can go for the best kind or a particular kind of help that they themselves need. There is a need. The project originated because people with a learning disability were not using services within the area. Now I think that the referral numbers to social work departments have gone up since the project came into effect. Brace is a club that's been running for a number of years. It's run by carers themselves. This is the only form of respite care that some carers have when their relatives come out to the Brace Club on a Monday night.
Well, it gives you a bit of free time on your own to do your own thing. And you know your son's getting well looked after. Your son or daughter, whatever it may be, is getting well looked after. So I feel you really do need a break. Everybody with a special needs kid does need a break at some point.
The club offers social and recreational activities, and I think they've tried to introduce some classes in arts and crafts and various other things, but it's a very lively club with a mixed group of people.
I think the Brace Club is one of the best clubs there.
Well, I came as a member. Now I'm on a committee and I help out with the kids and that.
They go out their way to organise holidays and activities.
I like the Brace Club and it's good. And it's good fun. And it's do everything like art, drawing, all different things, like swimming and that.
I would support the group by, for example, helping them to get the assistance of a tutor to come in to undertake the arts and crafts work on a Monday night. If there are any issues, such as grants, money, who do they ask, where do they apply to, then I would support the group to try and get them access to funding.
My doctor told me about the EDI, Easterhouse Drugs Initiative, and he told me it'd be a good idea, as I was a long-term user, to see what they had to offer me.
Easterhouse Drug Initiative is a community-based project. We are funded by the Health Board but managed by the Social Work Department within the Easterhouse area. We cover all of Greater Easterhouse, Bruckhazy, Cranhill, Ballarnock, the whole lot. We're really around to help people who have got drug problems in their families. We can go out and do training projects. We do prison visiting for people who have got a drug problem and are actually in prison at present. We have got 5 paid workers, 1 admin worker and 4 full-time counsellors, and we also work with volunteers. At present we've got 7 full-time volunteers. We cater for all sorts of people, anyone at all with a drug problem of any type. Really our typical client, I suppose, if we do have a typical client, is in their early 20s who've got an injecting drug problem or certainly an illegal drug problem. People with drug problems have a multitude of other problems, be them social, financial, legal, whatever, so we tend to deal with a lot of different types of problems. Very, very few people just come with a drug problem and that is all we deal with, so we tend to deal with a lot of different bits and pieces. We're very much an advocacy service. We do a lot of advocacy work on behalf of clients with GPs. We refer on, if it's appropriate, to welfare rights officers to the housing department, and also places like rehabilitation centres, so people can go either within this country or down south to England to a rehabilitation centre if that's what's going to help their drug problem.
Well, basically it's keeping me straight, it's keeping me from fixing heroin and temazepam.
The initiatives helped me a lot, because if it wasn't for the initiative I'd be in prison now, definitely. In prison, I'd also be in a hospital.
I think without a doubt there's a great need for the service in Easterhouse. All over Greater Easterhouse there's quite a significant drug problem, and obviously drugs don't just affect one person, they affect the whole family. We also run a family support group for families and friends of people who have got a drug problem.
I would recommend it, not just for them and their families get a lot of support here after drug counsellors, and it's pretty good.
We work generally in an abstinence way of working. Really, we look towards long-term abstinence. Obviously, because people have been perhaps using drugs for 10, 12 years, abstinence all of a sudden isn't always an ideal option for people, and it's a difficult thing to do. So really what we do is we work on a harm reduction policy, so far as if they are using drugs, they're using drugs as safely as possible, and they're doing as little damage to themselves primarily, but also to their families and the surrounding community as possible. We run a methadone harm reduction clinic with one of the GPs, which again works well, and that's got to be run very, very tightly because obviously it can be open to abuse. So we are very, very careful in what we do with that.
I'd recommend definitely the MD to come along with a drug problem, because it's really helped me and it's helped a lot of people I know.
Well, it's keeping me straight, it's keeping me stabilised. I'm not stealing, cheating, lying. Basically, it's just helped me get a life again.
Requests for help from the social work department often come from doctors, nurses, relatives and neighbours. You can, of course, contact the social work department in Greater Easterhouse yourself. Our main area offices are at 36 Westerhouse Road, Easterhouse, and 81 Bruckhazy Place, Cranhill. When you contact the social work department, a member of staff will discuss your situation with you and listen to your views on the kind of help you need. After the discussion with you, the member of staff may provide advice and information which meets your needs, suggest you see someone in another agency who will be able to help you, or arrange a further assessment interview. This can take place in your own home.
We very much involve the clients themselves and the carers in the assessment, and we take on board their views very, very carefully, and we try to match up what people's needs are with the resources that are available. What basically happens after an assessment has been completed is that the social worker will draw up something that is called a care plan, which details the needs that have been assessed and the resources that the social work department feel will meet those needs. If you're not happy with the care plan that's been drawn up, you have a right to complain to the local area manager. At all times we respect people's confidentiality. On occasion, however, we may find it helpful to discuss your needs with other professionals or members of the family. However, we will always get your permission first to do that. On occasion, people have details that they don't want to be disclosed to other people, and we always respect people's views. There's no doubt that there's an awful lot of need for community care services in Easterhouse. The amount of referrals that we've already had has risen dramatically, and we also know that there's an awful lot of people still in Easterhouse who haven't contacted the social work department to ask for an assessment of their needs. So there's no doubt that it's very, very important in Easterhouse.
If your needs are for straightforward practical help, services such as Meals on Wheels and Home Helps can be arranged via the home care team. If your needs are more complex or are likely to require help from a range of different sources, social work will arrange for someone to speak to you more fully. The social work department may wish to involve your doctor, hospital consultant and relatives in the discussion. Before doing this, your permission will always be sought. Some services used to meet people's community care needs in Greater Easterhouse include daycare in local centres, advice and counselling, welfare benefits checks, home helps, lunch clubs and social clubs, occupational therapy, equipment for disabled people, emergency alarm service, respite to give carers a break, help with sight or hearing loss, residential care, nursing home care, disability resource centres, centres for people with learning disabilities, and much more.
This is the Greater Easterhouse Alcohol Abuse Project, otherwise known as GAP. We're an urban aided project and have been up and running since November 1991. We come under the umbrella of the Glasgow Council on Alcohol. We serve a dual purpose here in Easterhouse, and that's to provide a one-to-one counselling session for people with alcohol problems and also people who are directly related to people with alcohol problems. We offer an outreach service through our outreach team, and this is done through schools and IT in the area. We also have a full band of voluntary counsellors to back this up. We take referrals from doctors, we take referrals from social work department, industrial, probation, and also very importantly self-referrals.
The project was set up 7 years ago, and to begin with, the biggest part of the work was in helping people from Gatlock Hospital in particular, long-term psychiatric patients, to resettle back into the community. And that piece of work was done probably within the first 2.5 to 3 years of the project. And although we still do that kind of work, because there are lots of people still coming back into the community from long-term care in hospitals, a lot of the work that we're doing now is working with people who have what the GPs call psychosocial problems. And those are depressions, anxieties, the difficulties in coping with life in an area where there is high unemployment, poverty, bad housing, things that lots of people and all of us suffer from in terms of mental health. We might be asked to offer support to a single mother whose relationship has broken down, who's socially isolated and who's very anxious or depressed. We might be asked to offer very practical help in befriending to someone who has come back into the community after living for a long time in a psychiatric hospital, and everything in between those two extremes.
The needs of carers are seen as being paramount in providing effective community care services in the Greater Easterhouse area.
It may be that a carer requires a bit of a break from looking after the person that they're caring for. We can get someone from our home support and daycare services to go out and to sit for a few hours with the person while the carer has a break. Other ways of looking at help is respite care can sometimes be arranged in order for the carers to have a break, and it also gives the person, the client themselves, a break away from their families.
Also within the area, the home care team are particularly active in supporting carers groups in the area. Carers groups for older people as well as carers groups for any client category.
Greater Easterhouse Social Work Department is committed to providing the best possible community care services for people living in our area. We are constantly trying to improve and develop the services that are being provided. If you feel we could help you, a member of your family, a friend or a neighbour, why not get in touch? We will be delighted to hear from you.
If you would like to know more about community care in Greater Easterhouse, call the Social Work Department now on 041 771 7401 or 041 770 8531.